Catheter cuts and punctures can be prevented if care is taken in handling the catheter during the implantation procedure. One source of catheter cuts and shearing comes from withdrawing the catheter through the introducer needle during catheter placement. This can partially cut the catheter or completely shear off the catheter end. Do not pull the catheter back to adjust its position while the needle is still inserted in the spinal canal. Instead, make the incision down to the lumbodorsal fascia. Remove the needle from the spinal canal, sliding it up to the proximal end of the catheter, and then adjust the catheter position. If difficulty is encountered while positioning the catheter, it is better to start over with a new needle puncture than to withdraw the catheter through the needle. The catheter guide wire can also cause catheter cuts. Removing a guide wire too quickly, especially from a catheter that follows sharp angles, can slice the catheter from the inside out. To minimize catheter cuts from the guide wire, use a paramedian oblique needle placement technique. When removing the guide wire, hold the catheter securely, but do not pinch the catheter tightly between your fingers or with an instrument. Then remove the guide wire slowly and evenly. Punctures in the catheter may occur if a strain relief sleeve is not used at the catheter or pump connection site. Repetitive motion can cause the catheter connecting pins to puncture the catheter if it is not protected. To avoid these types of punctures, always use the appropriate strain relief sleeves packaged with the catheter. Use caution when handling sharp surgical instruments such as suture needles, scalpels, and refill needles near the catheter. To protect the catheter during initial placement, leave the introducer needle in place when making the incision at the percutaneous insertion site. The introducer needle can also protect the catheter while placing a purse string suture in the underlying fascia around the catheter entry site. When closing both the spinal and pocket incisions, carefully note the location of the catheter to prevent a suture needle from puncturing it. Catheter punctures can also be prevented during pump refill and catheter access port procedures by using the templates provided in the appropriate Medtronic kit. The templates help locate the correct septum, reducing the chance that a needle will miss the septum and damage the catheter. Always coil excess catheter behind the pump and anchor the pump securely in the pocket. Failure to do so could allow the catheter to pass over the superficial surface of the pump and result in a catheter puncture from a refill or catheter access port needle. For more information on preventing catheter-related complications, consult your Medtronic representative.